Hi guys, this is Dr. Mirrafati from Mirrafati. If you followed me on the other video we did, I'm doing a series of video company VMS run by my good friend Maui in here. He's the engineer, CEO of the company as well. Great company, locally made, Southern California. So I thought it was interesting to talk about laser machine that's out there that everybody's trying to think for pain and for joint pain, elbow pain, for inflammation. And so I thought about doing a little video on this because this is a real deal. I'm just going to explain to you why it's a real deal. It's not a light therapy, it's actually a laser. And by the way, I did try it on my right knee. I was in pain and he was kind enough to give me a little treatment on both, and it took about 9 minutes, 5 minutes each side. And I truly felt better because I had a little bit of more mobility. It was painful, and it really helped
that's
out.
how it is.
So this is the machine, and there's a lot of companies. You go on the internet, there's a lot of people. Oh, you come in here, we do this, we do the red light, bright light, white light, blue light, all this other light. You just gotta make sure the machine you get, it's a real laser machine. At the end of the day, it has to be a medical graded machine. And this is what I love. I tried the one that he did for me was this one right here in the knee. And I can't obviously turn on the laser because it is laser. It gets really bright and gets hot. But you basically turn this machine on and I can probably press it away.
We can show the aiming beam. Yeah, correct. We'll do the knee. Okay, so
we can
yeah, you see it. Yeah, that's not the laser.
So, yeah, that's the laser. Now, if you hold it over here,
when you press it,
it gets really hot. And if you go back, normally you keep it at this. You can see the laser beam, and it's right on the targeted area. If it's a back pain, if it's
now it's firing. Yeah.
So basically, yeah, go ahead and hold it. So it actually does produce quite a bit of heat, and then you go closer, it actually
gets very hot.
So you don't want to get closer.
Correct.
So this is where your comfort level is, right here. And I truly feel it in my hand right now, and even though it's far away. So this is obviously, you want to have the safety goggle on, and we're looking away, but as you can see, our engineer is ready to go. But for me, it's just like, this is it. This is where you want to keep it at. And you put it on a treated area. If it's your neck pain, elbow pain, it's great for tennis elbow, joint pain on your knee. So this is where the inflammation is going to become handy in terms of reducing the inflammation and making the pain a little bit less. Now, we're doing plastic surgery. So what are we going to use this on? I'm actually going to use this on my post-op for breast augmentation to see if it does reduce the inflammation, to makes the pain less. Because remember, inflammation in the breast, I'm going to take my hand away because it's kind of hurting now. So inflammation causes pain, and pain obviously is not good. So post breast surgery, I am actually going to apply this on the breast area to reduce inflammatory pain. And we're going to do a double-blinded study. Like, we're actually going to maybe do one side and not the other side, and ask subjectively from a patient which side they have less pain. And obviously, over doing 50 patients, we get to find out how aggressively this is reducing pain. And obviously, we're going to keep you in tune with the whole thing. So if you don't mind, can you give us a little story about the machine that you actually created now?
So little about about the machine. First of all, our cells, right? Just like how we get energy from the sun, the laser simulates that. Now for here, this is not a toy. It's actually FDA cleared. So it goes very deep. And here's one thing, people, about lasers. It actually energizes your cells. It's like you getting a supercharge, right? Instead of you without that movement, what do we treat nowadays? Bengay, this and that. This will go deeper, and it will affect on a molecular level. That's the difference. And as such, with this machine, it benefits your patients. You can see a very easy to use interface. You just set it.
So this is for the neck.
You have the neck.
This is for the spine and the back, right? This is for the lower back, right? This is for scapular and shoulder area. You got knee. And again, it's sort of a dummy proof, right?
Correct.
You just hit it and point and do your thing.
Correct.
Right? Obviously, you got to keep this away from the skin, and hopefully, the patient will give you some feedback. Oh, it's too close, it's burning, and you keep it back, right?
Correct. Yeah.
So go ahead. I'm sorry, I interrupted you.
No worries. Yeah, so the good thing about I would say a professional device, it really worked. Okay, because if it wasn't, then we wouldn't even be in existence. But just a warning for most of you, all of you that go to social media, there's so many toys out there showing red light. So here's the thing, right? You're a doctor. If you don't get like a tingly feeling right after that getting exposed. Is it working?
Right.
It's like if you're getting a laser treatment, if you don't get any erythema or or swelling, then it's not something that works.
Correct.
It's all libido effect. You see what I'm saying, Doc?
Yeah.
So with this, it's artificial like tap, and the best part of this for advanced pain, we have multiple wavelengths. So the wavelengths, it's really more in tune to it depends on the wavelength. It's like a channel where in specific channels reach different structures of the body, tissue, right, epidermis, dermis, and whatnot. But something for this, you really want to target, the part wherein you're for muscle, tissue, and all that for recovery.
Amazing. So we're
Yes.
going to put this to test. As he said, it's really amazing what he says. I think anything you do is better than nothing, right? But for whatever you're doing, as long as you're not spending a lot getting those little stuff off the internet,
Yes.
okay, if it makes you feel good, as he said, there's a
It's
lot
a
of placebo
Correct,
effect.
placebo.
You're doing something, oh my God, I feel good. This is a real deal. It's a laser machine. It does well. We're gonna test this out for a bunch of areas in a body, and we keep you in tune. So stay well, stay healthy, and follow us.